My name's Dr. Gavin Britton. I'm one of the medical doctors. Is it Peter Sunderland?
Yes.
I've been asked to have a look and examine your abdomen today, if that's all right.
Yes.
I'm going to start by having a look at you from the end of the bed. Could you pop your hands onto your hips for me, please? Okay. And if I can start by asking you to put your hands out for me. And can you turn them over? Thank you. And if you spread your fingers back for me, that's it. Okay. And if you can just turn this hand over, I'll just have a look at this finger. And if you can cock both of your wrists back like this for me, that's it. Okay, and you can rest that arm down and I'll just have a feel of your pulse. Thank you. Okay, and you can rest that arm down now. If you can just move your head to the left for me, please. Thank you. Please, would you be able to pull one of your eyelids down? Okay, and if you could open your mouth for me, please. And stick your tongue up to the roof of your mouth. That's brilliant, thank you. And if you could sit forward for me, please. I'm just going to have a look at your back and a feel of your neck. I'm just going to lie the bed flat. You just rest where you are for a second. And if you lie back when you're ready. I'm going to have a look at your chest now. Is it okay if I have a feel of your chest? Thank you. Is it okay to have a feel under your armpits? Yes. Thank you. Just have a feel with the other hand. Okay. Could I get you to undo your belt buckle slightly for me, please? Do you have any pain in your abdomen?
No.
Would it be alright if I have a feel of your abdomen?
Yes.
Thank you. Could you give me a cough? Just going to feel a bit deeper now. Would you be able to breathe in and out for me, please? That's okay. Same again, if you breathe in and out for me. Would you be able to roll onto your left-hand side for me, please? Your right-hand side. Thank you. And again, breathe in and out. And please roll back onto your back for me. I'll just have a feel underneath your back.
1 minute remaining.
I'm just going to tap across your abdomen now. could you roll towards me, please? Thank you. And if you roll back again. I'll just have a feel in the middle. Okay, and I'll have a listen as well. Just going to have a look at your ankles now. Thank you. Are you comfortable?
Yes.
Okay. To complete my examination, I'd like to examine the hernial orifices, the external genitalia, perform a rectal examination and urinalysis.
Please present your findings.
This elderly gentleman presents with findings in keeping with stigmata of chronic liver disease, and there were multiple spider nevi, gynecomastia, abdominal distension with shifting dullness in keeping with ascites. There was also a raised JVP and evidence of pedal edema. Important negatives were a lack of encephalopathy, and there was no evidence of jaundice. This presentation would be in keeping with liver cirrhosis. As an aside, this gentleman did have atrial fibrillation.
If I told you that you had a high temperature, what investigations would you like to undertake?
So in that case, I would be concerned about spontaneous bacterial peritonitis, and I would want to do an urgent ascitic tap. On this, I would be looking for a raised corrected neutrophil count, and I'd be concerned about levels over 250, which would be consistent with spontaneous bacterial peritonitis. I'd also be looking out for the initial gram stain and later on the culture result. I'd want to start this gentleman on broad spectrum antibiotics.
Okay. What other investigations would you like to do in a gentleman presenting with ascites and stigmata of chronic liver disease?
So I'd want to perform baseline blood tests, and I'd want to check this gentleman's full blood count, looking for any evidence of anemia, infection and his platelet count. I'd then want to go on to check this gentleman's synthetic liver function, in particular his clotting and his albumin level. I'd then move on to checking his renal function, looking for any coexistent renal impairment, and perform basic liver function tests, including an AST, gamma GT and an AFP.
Why would you want to do an AFP?
Because this gentleman has liver cirrhosis, I'd be concerned that he may have developed a complication of hepatocellular carcinoma.
So you've told me this gentleman has features of cirrhosis. Is there anything else you would like to arrange for this gentleman?
So I'd want to arrange an endoscopy, and I'd be looking out for the presence of varices, also portal hypertensive gastropathy, and also Graves' syndrome.
What's the likely cause of his cirrhosis?
So the most common cause of cirrhosis in the UK is alcohol use.
Would you also like to check for hepatitis?
Yes, so I would want to arrange further investigations, including a hepatitis screen, checking this gentleman's ferritin and further iron studies, as well as potentially checking his copper and inquiring about his family history and other features in the examination that may be present in his history.
Is there anything else you'd like to check in the ascites?
So I'd want to evaluate this gentleman's level of albumin in the ascites, and I'd be wanting to work out the serum ascites albumin gradient. In this gentleman, I would suspect that this gradient may be over 1.1 grams per litre, and this would be consistent with liver cirrhosis.
What other conditions cause a high gradient?
So other conditions causing a high serum ascites albumin gradient would be congestive cardiac failure, Budd-Chiari, nephrotic syndrome, and in females, Meigs.
What about if it was a low gradient?
Low gradient may give differentials of tuberculosis, malignancy and pancreatitis.
Okay. Do you think this gentleman needs a liver biopsy?
So initially I would want to perform the baseline blood tests I mentioned, and if there was a low albumin and a derangement of his clotting, and I would combine this by performing a fibroscan, this may give me enough information to diagnose liver cirrhosis due to potentially previous alcohol use. If a tissue biopsy was required, I could go on to perform a liver biopsy, but this would need to be done by the transjugular route because of the presence of ascites.
Okay, thank you very much.
Thank you.